If you are over 65, or if you have a parent, a spouse, or a grandparent in that age group, there is a very good chance that at some point a doctor, a pharmacy machine, or even a home blood pressure monitor has given you a number and left you wondering, is this actually good? Is this actually dangerous? Or is this just what happens when you get older? Most people assume there's one simple, universal target that applies to everyone, something they memorized years ago and have been chasing ever since. But the real answer, the one most people have never actually been told clearly, is more surprising, more nuanced, and honestly more important than a single number written on a chart. Stay with me until the very end of this video, because the way this topic is usually explained leaves out something that could genuinely change how you think about blood pressure after 65. Let's start with where most people's understanding comes from in the first place. For decades, the number that got repeated everywhere, in doctors' offices, in pamphlets, in casual conversations at the pharmacy, was 120/80, often described as the gold standard, the number everyone should be aiming for no matter their age. And for a long time, this was treated as a fixed, one-size-fits-all target. If your numbers were higher than that, the assumption was simple: you needed to bring them down, through medication, through diet, through whatever it took, until you reached that magic number. But here's what almost nobody explains clearly, and it's the exact reason this topic deserves a much closer look. As the body ages, blood vessels naturally lose some of their flexibility. They become slightly stiffer over the decades, which is a completely normal part of aging, not a disease in itself. This stiffness tends to push blood pressure numbers upward somewhat, even in people who are otherwise in excellent health, eating well, staying active, and managing stress. This means that the exact same blood pressure reading can mean something quite different for a 35-year-old compared to someone who is 75. Treating both of them with the exact same fixed target, without any adjustment for age, biology, or overall health, is where a lot of confusion, and sometimes real harm, can quietly creep in. This brings us to something that major medical and cardiology organizations have actually been re-examining and adjusting over recent years, which is the idea that blood pressure targets for older adults should not be treated as a rigid, universal number, but rather as something that gets carefully individualized based on a person's overall health, their other medical conditions, how well they tolerate medication, and their personal risk factors. In other words, the honest, evidence-based answer to what's the ideal blood pressure after 65 isn't a single number that applies to every senior on the planet. It's closer to a personalized range, one that a doctor determines by looking at the whole picture, not just the number on the cuff. Now, this doesn't mean there's no useful general guidance at all, so let's talk about what research has actually shown. Large-scale studies involving older adults have found that, for many seniors who are otherwise relatively healthy and don't have significant frailty or multiple complex conditions, more intensive blood pressure control, generally aiming for numbers somewhat lower than the old standard, has been associated with a meaningfully lower risk of serious cardiovascular events, including heart attacks and strokes. This was actually one of the more surprising findings in modern cardiology, because for a long time, there was a widespread assumption that being a bit more relaxed about blood pressure targets in older age was the safer approach. Some of the research actually pointed in the opposite direction for certain groups of seniors, showing real cardiovascular benefit from more careful control. However, and this is the part that gets left out of a lot of casual conversations about this topic, that same research also showed that pushing blood pressure numbers down too aggressively, especially in seniors who are frail, who have multiple chronic conditions, who are prone to dizziness, or who have a history of falls, can actually introduce new risks. Blood pressure that drops too low can lead to lightheadedness, especially when standing up quickly, a phenomenon doctors often refer to as orthostatic hypotension. For an older adult, a sudden dizzy spell isn't just an uncomfortable moment, it can directly lead to a fall, and falls in seniors are a serious concern, sometimes leading to fractures, hospitalizations, and a difficult road to recovery. So the honest, complete picture here is that both extremes carry risk. Blood pressure that's too high over the long term increases the risk of heart attack, stroke, and kidney problems, while blood pressure that's pushed too low too aggressively, particularly in someone who is frail, can increase the risk of dangerous falls and other complications. This is exactly why the modern, more accurate answer to this question involves a conversation, not a single memorized number. A relatively healthy, active 68-year-old with no significant other health issues might genuinely benefit from a somewhat lower blood pressure target, closely aligned with modern cardiology guidance. Meanwhile, an 85-year-old managing several chronic conditions, taking multiple medications, and dealing with balance issues might have a doctor intentionally set a slightly higher, more cautious target, specifically to avoid the real danger of a fall. Both of these approaches can be completely correct for their specific person at their specific stage of health. This is precisely why comparing blood pressure numbers with a friend, a neighbor, or even a sibling, and assuming everyone should be aiming for the exact same target, can actually be misleading. Let's also talk about how blood pressure should actually be measured, because this affects the accuracy of the number just as much as the target itself. A single reading taken once at a doctor's office isn't always the full story. Many people experience what's often called white coat hypertension, where simply being in a medical setting, sometimes feeling a bit anxious or rushed, causes blood pressure to read higher than it typically is in daily life. On the flip side, some people experience the opposite, called masked hypertension, where their office reading looks perfectly normal, but their blood pressure is actually elevated during regular daily activities at home. This is exactly why many doctors now recommend home blood pressure monitoring, using a proper, validated cuff, taken at consistent times, ideally sitting quietly with feet flat on the floor and the arms supported at heart level, rather than relying entirely on a single reading taken during a rushed appointment. There's also real value in understanding the two numbers themselves, rather than just glancing at whichever one seems higher. The first number, called systolic pressure, reflects the pressure in the arteries when the heart beats and pushes blood out. The second number, called diastolic pressure, reflects the pressure in the arteries when the heart is resting between beats. As people age, it becomes increasingly common for the systolic number to rise more noticeably than the diastolic number, sometimes even while the diastolic number stays relatively normal or even drops slightly. This specific pattern, called isolated systolic hypertension, is actually quite common in older adults and deserves just as much attention as a situation where both numbers are elevated together, even though it can sometimes get overlooked simply because the lower number looks reassuring at first glance. Now, let's talk about what this all means practically, because understanding the nuance is only useful if it leads to something actionable. The first step is simple but often skipped: having an honest, specific conversation with a doctor about what target actually makes sense for that individual, taking into account their overall health, their other conditions, their medications, and their personal risk of falls or dizziness. This conversation shouldn't happen once and then be forgotten. It's worth revisiting periodically, especially if health circumstances change, new medications are introduced, or new symptoms like dizziness start appearing. The second step is paying attention to how blood pressure is actually being measured day to day, not just relying on a single number from one appointment months ago. Home monitoring, done consistently and correctly, tends to give a much more accurate, real-world picture than an occasional office visit alone. The third step involves recognizing the warning signs that blood pressure might be too low rather than too high, things like feeling dizzy or lightheaded when standing, unusual fatigue, or episodes of near fainting, and reporting these to a doctor rather than assuming they're simply an unavoidable part of getting older. It's also worth mentioning the lifestyle side of this conversation, because medication is only one part of the picture. Regular physical activity, appropriate for someone's individual ability and health status, tends to support healthier blood pressure over time. Reducing excess sodium intake, maintaining a healthy weight, moderating alcohol, managing stress, and getting consistent, quality sleep all play a meaningful role as well. None of these lifestyle factors replace medical guidance or prescribed medication when it's needed, but they do work alongside it, and for some seniors, Meaningful lifestyle adjustments can make a real difference in how much medication is ultimately needed to reach a safe, appropriate target. There's one more piece of this that deserves real attention, and it's something families often overlook entirely. Blood pressure targets aren't something that get set once and then remain fixed forever. As a person's health changes over the years, what counts as an appropriate, safe target can shift too. Someone who was perfectly capable of tolerating a lower blood pressure target in their late 60s might, 10 years later, be more prone to dizziness or falls, meaning their target may reasonably need to be adjusted to be a bit less aggressive. This is exactly why ongoing conversations with a doctor matter so much more than simply memorizing a number once and assuming it applies forever. There's another layer to this topic that rarely gets discussed, and it has to do with how confusing and inconsistent the messaging around blood pressure has been over the years. Someone who is now in their 70s may vividly remember being told one specific target number back when they were in their 50s or 60s, only to be told something slightly different by a different doctor years later, or to read something different online. This isn't because doctors keep changing their minds carelessly, it's because medical understanding genuinely evolves as more research becomes available, and because guidance has increasingly shifted away from a single universal number toward a more individualized approach. Unfortunately, this evolution in medical thinking doesn't always get explained clearly to patients, which leaves a lot of people feeling like the goalposts keep moving without any real explanation, when in reality, the shift reflects a more thoughtful, more personalized approach than what existed decades ago. It's also worth talking about how this misunderstanding can play out inside families, because it happens more often than people realize. Picture two siblings, both in their 70s, each with a slightly different blood pressure target set by their own doctor based on their individual health. One sibling might see the other's numbers and immediately worry, or even feel encouraged to demand the exact same, lower, target from their own doctor, without factoring in that their own health situation, medication list, or fall risk might be completely different. This kind of comparison, while completely understandable and coming from a place of genuine concern, can actually lead someone to push for a target that isn't appropriate for their specific circumstances. Understanding that blood pressure targets are meant to be personal, not universal, can help prevent this kind of well-intentioned but potentially misguided comparison. Another point worth raising is the emotional side of managing blood pressure as a senior, because numbers on a screen can carry a surprising amount of psychological weight. Many older adults describe feeling anxious every time they check their blood pressure, almost bracing themselves for a bad number, and that anxiety itself can actually cause a temporary spike in the reading, creating a frustrating cycle where worry about blood pressure ends up affecting the very number being measured. Understanding that occasional fluctuation is completely normal and that a single higher reading during a stressful moment isn't automatically a crisis can genuinely ease some of that day-to-day anxiety, while still taking the overall pattern seriously and discussing any real concerns with a doctor. It's also helpful to understand what a consistent pattern actually looks like versus a single unusual reading. Blood pressure naturally fluctuates throughout the day, influenced by activity level, stress, hydration, recent meals, and even the time of day itself. A single elevated reading taken right after a stressful phone call or a rushed walk up the stairs doesn't necessarily reflect someone's true baseline. This is exactly why doctors generally look at patterns over time, often reviewing several readings taken under similar, calm conditions, rather than reacting dramatically to any single number in isolation. Keeping a simple written log of home readings, noting the time of day and any relevant context, can make these conversations with a doctor far more productive and accurate than relying on memory or a single office visit. One more thing worth mentioning before we wrap up is the role that caregivers and family members can play in supporting a senior through this process, especially for those who live alone or manage several medications on their own. Simply helping keep track of readings, accompanying a loved one to appointments when possible, and gently encouraging consistent home monitoring can make an enormous difference in catching patterns early, whether that pattern points toward blood pressure creeping too high or dropping unexpectedly low. This kind of quiet, supportive involvement often matters just as much as any medication or lifestyle change, simply because it helps ensure nothing important slips through the cracks. So, coming back to the original question, what is the real ideal blood pressure after 65? The honest and complete answer is that there isn't one single number that applies to every senior everywhere. The most accurate answer is that it depends on the individual, their overall health, their other conditions, and how well they tolerate treatment, and it's determined best through an ongoing, personalized conversation with a doctor rather than a number memorized from a pamphlet or repeated casually among friends. What matters most isn't chasing a specific figure at all costs, it's understanding the full picture, being monitored consistently and accurately, watching for warning signs in either direction, and adjusting the approach over time as health circumstances change. All the information shared in this video is intended purely for general awareness and is not a substitute for personalized medical advice. Blood pressure targets should always be discussed directly with a qualified doctor who understands an individual's complete health history, current medications, and personal risk factors. If this video helped clear up something you've been wondering about, make sure to subscribe to the channel so you never miss information that could help protect your health or the health of someone you love.